Hi guys, how you doing? Dr. Aman from Arora Medical Education here. Have you heard of the double ICE concept that we teach about at our courses, PLAB 2, SCA, UKMLA, etc.? Do you use the double ICE in your data gathering? Have you found it of benefit? And when should you use the double ICE concept? This I'm going to talk about in this short, sharp video. We teach it a lot on our role plays and mocks, for example. So if you've been on one of those, then I'm sure you have heard about this. So we all know about ICE, single ICE. Everybody does an ICE. We talk a lot about understanding the patient's mind, asking about their ideas, their concerns, expectations. We've got a lot of videos on the channel about what that is, how to use it, what are the right frameworks, how to make it less doctor-centered, etc. So this video is not talking about ICE in itself. It's talking about this concept that we teach of double ICE. When do you have to think about two minds and understand two sets of mind issues? Imagine, for example, you're seeing a relative of a patient, okay, in a role play. Say somebody's son has come to see you about their father. Now, we talk a lot about understanding two minds here. Often we do one or the other, or actually, in fact, in a third-party consultation, often we don't do any ICE because we think, well, the patient's not there. So think about this. You get a son who comes to see you, for example, they're worried about their father who's losing their memory, for example. Now, this double ICE concept means you spend a little bit of time understanding the son's mind, but you also spend a little bit of time understanding the relative's mind or the patient's mind, because you might be able to get some issues and then take the story forward from two angles. So, for example, let's focus on the son. Mr. X, obviously you've come to have a bit of a chat about your father and his memory. What were your thoughts about all of this before you came to see us? You know, maybe the son has some thoughts that it is just, I don't know, normal old age, or it's just natural, or it's in his genes, it's all genetic, who knows, but I need to understand his mind. Secondly, Mr. X, obviously you've taken the time out to come and see me in the clinic. Was there anything particularly worrying you about all of this? Maybe their worry is that their father is going through, or I don't know, Parkinson-linked dementia. Who knows? There might be a particular worry there. Again, important to pick that up because you need to understand how to talk about that later on. And then expectation. Mr. X, obviously you came here to have a chat with us today. Was there anything particularly you thought that we could do for all of this? Maybe his expectation is that we would arrange a referral to a memory clinic, for example. Again, remember, ICE is not about answering can I do it or not, it's about understanding what's in their mind so you can utilize those things in the second half. So that's one set of ICE. But remember, you've got a second person in the consultation here. You've got the father. Now, it's also useful sometimes to understand a little bit about what the father might be thinking as well. Now, of course, the son may or may not know this, but I don't know that until I've asked the question. So, for example, Mr. X, you've come here to talk about your father. You mentioned that he knows that you're coming to the clinic today. Was there anything that was going through his mind about all of this? Have you discussed it with them? Now, maybe the son might say, yeah, to be honest, doctor, he just didn't think much of it. He thinks it's pretty normal. He just thinks it's just a little bit of memory loss that everybody gets at some point. Okay, important for me to understand where the father's mind is. Okay, was there anything that you knew that he was particularly worried about with all of this? I don't think he's worried about what it could be, to be honest, doctor, but I know deep down that he was worried that he might forget something really important, like a password, for example. Now, again, if I don't ask that question, I don't get that information, and therefore I can't utilize that maybe in the second half. Expectation. Mr. X, look, I know you're here and you're talking about this with me, but I know that your father knows that you're coming today. Do you know if there's anything that was in his mind that he thought we could do for all of this memory issue? Yeah, doctor, to be honest, he wasn't really keen on a clinic. He didn't think that he needs that, but he did think that maybe he needs some basic blood test checking. He mentioned things like iron levels. I just wonder if that might be useful. Now, can you see by me asking a second ICE here, the ICE of the person who's not even in the room, I've actually almost doubled the number of issues that I can talk about in the second half. And I've reduced the need of the son to bring things out in the second half as a surprise, because I haven't either found it out or because I didn't realize that he knew what was going through his father's mind. So this double ICE concept is really important, and we teach it a lot at the academy, and we teach it a lot in our ultimate packages, because it gives you so much in a third-party case. Now, this is not just a third-party relative case. Think about a scenario where you're sitting in clinic and a district nurse or a palliative care nurse or one of the nurses on your team come to talk about a particular patient. Now, this double ICE concept is important here as well. So, for example, I'm finding out from the nurse, like, what were your thoughts about all of this? And was there any particular worries that you had regarding this? Or was there anything that you thought I could do in particular? But don't forget the other angle as well. Like you mentioned, you spoke to Mrs. X. What was going through her mind? Did you know? Or did you know if anything was particularly worrying them about all of this? Or was there anything that you thought or that they mentioned that they thought we could do to help with all of this? Can you see how, again, it's a relative and a patient. In this case, it's a patient and a third-party colleague, but that double ICE concept is still very important, because remember, data gathering is all about understanding issues. We teach this a lot in our courses. It's an issues gain. The more issues I can understand, the more I can bring back in the second half. Issues come from the mind, and that's why ICE is important. It's one of the 3 Arora bubbles of data gathering. We've got another video somewhere. I'm sure you guys are familiar with the 3 Arora bubbles of data gathering. But sometimes you need to double down and get a double ICE. Because if I just assume that I know what the patient's thinking or the patient's worried about, or I assume that I know what the relative or the colleague is thinking about or wanted from this consultation, then I'm making too many assumptions. When you start making assumptions, then things come out and surprise you in the second half. So when you're practicing your role plays, when you're at the academy, which a lot of you guys hopefully will be for PLAB 2 or UKMLA, or whether you're doing your SCA mocks that we do for MRCGP, if you get a third-party consultation in your data gathering, make sure you practice this double ICE concept. It can make such a big difference in terms of how much information you have to manage in that second half. Now, if you guys are coming to the PLAB 2 Academy, or you're planning to book, or you're planning to use our SCA Ultimate Package, or any other material for SCA, PLAB 2, UKMLA, or even AKT, MSRA, PLAB 1, etc., please use the coupon Arora Video 10 for 10% off anything on the website. I hope we get to meet you at some point soon. Please do go and look at some of the other consultation skills videos, particularly the ICE videos. We've got some videos on what is ICE, like I said, how to make it less doctor-centered, how to make it less formulaic, when to do ICE, what is the purpose of it, etc. But I really do hope that your preparation is going well. I hope we get to see you at some point in the future for whichever exam that you're preparing for. #CanPassWillPass, #I went with Arora. Have a super day.